Good day, sir. I am Gulmayo from BSN 2-9 and I will be reporting the drug literature of aspirin or acetyl salicylic acid. For indications, aspirin is a generic medication used for pain, fever, inflammation, heart attacks, and etc. It is commonly prescribed because of its properties, such as anti-inflammatory, anticoagulatory, fever-reducing, and pain-relieving. The major component of aspirin is acetyl salicylic acid, which gives it all these properties. For contraindications, contraindicated in patients hypersensitive to drug and in those with non-steroidal anti-inflammatory drugs, induce sensitivity reactions or bleeding disorders, such as hemophilia, von Willebrand disease, telangiectasia, bleeding ulcers, and hemorrhagic states. Use cautiously in patients with gastrointestinal lesions, impaired renal function, hypoprothrombinemia, vitamin K deficiency, thrombocytopenia, or thrombotic thrombocytopenic purpura. Avoid use in patients with severe hepatic or renal impairment, G6PD deficiency, or history of active peptic ulcer disease. For the side effects, the most common side effects of aspirin are stomach or gut irritation, indigestion, and nausea. The following adverse effects are less common: worsening asthma symptoms, vomiting, stomach inflammation, stomach bleeding, bruising. And also, aspirin have very serious side effects, such as bleeding in the brain or stomach or kidney failure. A rare side effect of daily low-dose aspirin is hemorrhagic stroke. For interactions, antacids may decrease the salicylate blood level, ACE inhibitors, or angiotensin-converting enzymes inhibitors may have a decreased anti-hypertensive effect, increased risk of bleeding when used with another anticoagulant, NSAID, or non-steroidal anti-inflammatory drugs, or thrombolytic. Corticosteroids may cause an increased salicylate excretion effect. Furosemide may have an increased diuretic effect. Increased risk of Reye syndrome in use with a live varicella vaccine. May reduce the excretion of methotrexate, leading to toxicity. May reduce the effectiveness of spironolactone. May reduce the absorption of tetracycline or buffered aspirin. Bleeding risk may increase when used with the following herbs: cayenne or cayenne, chamomile, clove, garlic, ginger, ginkgo biloba, ginseng, and licorice. For the dosage, tablet 81 mg, 325 mg, and 500 mg. Tablet that delayed release, 162 mg, 325 mg, and 500 mg. Tablet that is chewable, 81 mg. Tablet that is enteric coated, 81 mg, 162 mg, 325 mg, and 650 mg. Capsule that liquid filled or Basalor, 81 mg and 325 mg. Extended that release capsule, Durlaza, 162.5 mg. So for the example, in pain and fever, immediate release 325 to 650 mg per orem every 4 hours as needed, or 975 mg per orem every 6 hours as needed, or 500 to 1000 mg per orem 4 to 6 hours every 4 to 6 hours for no more than 10 days, not to exceed 4 gram per day. For the rectal, 300 to 600 mg every 4 hours for no more than 10 days, or as directed by healthcare provider. For administration per orem, for patient with swallowing difficulties, crush non-enteric coated aspirin and dissolve in soft food or liquid. Give liquid immediately after mixing because drug will break down rapidly. Give capsules with full glass of water. Give tablets with food, milk, antacid, or large glass of water to reduce gastrointestinal effects. Give enteric coated, immediate release capsules or extended release forms. Wool, don't crush or break. For acute myocardial infarction, have patient chew non-enteric coated tablet. For rectal, refrigerate the suppositories. For nursing intervention, first is routinely monitor the effectiveness of aspirin by assessing pain levels and fever reduction. Second is monitor for signs of toxicity, diplopia, EKG, changes, seizures, hallucinations, tremor, confusion, lethargy, and anaphylaxis. The elderly are at a greater risk for toxicity. Close monitor hemoglobin, hematocrit, INR, and renal function when prescribe long-term therapy. Fourth is activate charcoal can be administered for aspirin poisoning.
And that's all. Thank you for watching.